Gum disease is a silent killer in the mouth, just like heart disease is a silent killer in the body. You may have it and not be aware of it. This short presentation is about how to have healthy gums fast, without stress, and help your heart. According to studies at the American Heart Association, infected gums allow bacteria to enter the bloodstream and make their way to the heart. Hello, my name is Dr. Mike Neely, a general dentist and former assistant clinical professor at Baylor Dental College. In less than 3 minutes a day and within 2 weeks, you can have strong gums that don't bleed, support better heart health, and as an added bonus, reduce the need for extensive dental work. This is what unhealthy gums look like. This is where bacteria get into the bloodstream at the neck of the tooth. Surprisingly, this patient brushed her teeth just before she came into my office when I took this picture. This is the same patient 10 days later after I showed her this new technique. No dental cleaning had been performed up to this point. An amazing difference. This is what you can do with just a toothbrush in just 3 minutes a day. It took only 10 days to get the gum strong and eliminate the portal where bacteria enter the bloodstream. How can you tell if you have infected gums? Pink in the sink and red on the floss. Healthy gums do not bleed when you brush or floss. If you have bleeding when you brush, you have an infection, period. What we've been told in the past and what you've seen on TV doesn't work. If you're using a soft toothbrush and purposely avoiding the gums, you're doing it wrong. Well-meaning dentists have given us incorrect information. We were taught, don't brush too hard with a firm toothbrush. It will cause gum recession and create notches in the sides of your teeth. This is false. Truth is that a brush cannot cut through enamel, and a soft brush doesn't get the job done. Can a toothbrush cause this damage? For years, we've been told that a toothbrush causes these notches. You can see why someone might come to this conclusion. But here, only 2 teeth in the entire row are affected. The adjacent teeth are perfect, no notches. And besides, you don't see bruising or lacerations on the gums. If a toothbrush could cut through enamel, you would see this on the tops, the biting surface of the teeth. I've never seen this in over 40 years. Question: if your gums bleed when you brush, were the nylon bristles too sharp or were your gums too weak? You cannot do damage to your teeth or gums with a toothbrush. What you're seeing here is caused by erosion and not by a toothbrush.
Okay, this is how you brush. You brush the tops of the teeth first, back and forth, just scrub them real good to get the foam going, both sides, and do the upper and the lower, just like that. Then you switch to the sides of the teeth and scrub in tiny circles, driving the bristles in between the teeth as much as you can. Make sure you spend as much time on the gums as you can. Go all the way around to the front, keep going, brush those gums. Really scrub them hard. Go all the way to the other side. And after you finish that, we're going to go to the tongue side and do the same thing on the gums. And when you get to the front, the brush doesn't fit sideways, so you have to use it going back and forth in the front, just like that. And that's how you have healthy gums.
Get a good firm manual toothbrush. Electric toothbrushes are okay, but not nearly as good as a plain old firm toothbrush you can use with vigor. Your gums may bleed a little at first, but will stop bleeding in a day or 2. And in less than 2 weeks, you will see a marked difference. Try and push the bristles of the brush in between the teeth and move it side to side. If all you're doing is brushing the tops of the teeth, you're missing 75% of all the enamel surfaces in your mouth, not to mention leaving bacterial plaque on the gums. Toothpicks are great too, and they do not damage your teeth or your gums. There are several kinds of floss aids you can buy. The best one is the one you will use. What about toothpaste and mouthwash? It doesn't matter what kind of toothpaste you use, and mouthwash is minimally effective at killing bacteria. Yes, some products can kill bacteria, but only those on the top layer of the bacterial plaque. It's a waste of money and leaves too many bacteria behind. It's not what you put on the teeth that makes the difference. It's what you take off the teeth and gums that gets the job done. Question: what do you do when you finish brushing? You rinse out, and you rinse out all the stuff in the toothpaste that you were trying to put on your teeth. It goes down the drain. The bottom line is you should brush your gums more than you brush your teeth. Let me say that again. Brush your gums more than you brush your teeth. On the tongue side and on the cheek side. Your teeth will not be damaged, and the teeth will get clean in the process, and you won't have bad breath. Your gums should have a stippled appearance, like the skin of an orange. When you brush this way, one, you increase circulation to the area and you bring natural antibodies in to fight infection. And two, you tighten up the gum tissue around the tooth. This prevents bacteria and food from getting underneath the gums, which is the major reason for tooth loss. The difference is night and day when you do this right. Again, here was my patient before she was taught brushing for gum health. Here she is 10 days later and before she had her teeth cleaned by the hygienist. No bleeding, no infection. What we are suggesting is not a substitute for getting your teeth cleaned, but an important first step. You can have gums of steel, save thousands of dollars in dental bills, and help protect your heart. Thanks for watching.